said it before, but when you get an introduction to a person from a previous guest on the show and a great supporter of the Maverick community, it was Nick from Seed in Brighton. And then we'll put the in the show notes, we'll put the episode we did with Nick, which was actually a totally different subject we were going to be talking about. It was about performance marketing and how you actually do that in the right way, taking care of your people and your customers, which is a totally different subject today. But he has met today's guest, Ruth, and he introduced me to Ruth. And very quickly it became clear to me that we actually had to have that conversation on the podcast because Nick has recommended it, but also because I could see that, we've been talking a lot about mental health in industry, but where has it actually landed? Have we lost a bit the focus on it? I thought that Ruth's perspective that you hear in a moment is slightly different than just a normal mental health kit you can download and work with your team on. It's probably a bit more deep and actually going to the root cause and actually behavioral change and cultural and system change that actually make sure that actually the big responsibility we have with both the young people and all the people who work in our industry when they move on to life, because it is a high pressure industry and it comes in waves, and sometimes it's easier and sometimes it's harder, but actually how do you prepare for the hard times and how do you become resilient? What we're going to talk about today. Welcome to the show, Ruth. I'm super excited about our conversation today. It's a difficult subject where there's a lot of pressure on lots of managers and leaders in different organizations across the world.
Yeah, absolutely. Well, thank you so much for having me. It's really nice to hear people are interested, I suppose, in talking about mental health in lots of different industries rather than just within healthcare, because it's so important.
Yeah, and Ruth, talk a bit about your background. It was quite interesting, quite an organic journey you've been on, and then you ended up setting up Certified Minds, which is your business today.
Yeah, absolutely. So I'm a registered mental health nurse by background and essentially started my career working in CAMHS, so child and adolescent mental health services. To be honest, as soon as I got to CAMHS, I was like, right, teenagers are my guys. This is what I want to do. They're awesome. Very misunderstood cohort of society. I think we're really good at talking to children and to adults. And there's this like gap in between where everyone starts going, oh my goodness, I don't know how to talk to teenagers, or I'm just going to avoid, or they're the awkward ones. But actually, usually it's us that are the awkward ones and don't know what to say. So I found sort of that niche. I then quite quickly became very interested in working with young people with eating disorders. Went on to manage an eating disorder inpatient unit down here in Brighton. And I guess, look, cutting a really long story short, as a ward manager, we went into lockdown over COVID, which was incredibly difficult, but to be honest, felt very proud, I think, of how we did, and quite honoured that, okay, I had 16 children. We went into lockdown. They didn't see their families for 3 months, but honoured that I got to be that safe adult for them during such a difficult time, and that the parents trusted us. I think it was huge to have these young people. As COVID lifted, started going back into pediatrics and assessing young people for a specialist bed. I'm sure we know we've got about 15 to 20% max specialist beds in the country than we had sort of in the 80s and the 90s. And so loads of young people are going into pediatrics. They are being detained under the Mental Health Act. They need specialist treatment, and we don't have the beds. So there's a lot of children that are now stuck, unfortunately, surviving in hospital for months on end without any physical health needs necessarily, awaiting sort of an exit plan. What I noticed then was that actually in pediatrics, they don't have or have very, very little mental health training. And, these young people are super high risk and were, through no fault of the pediatric staff, not being cared for in the most appropriate way, I would say, because there wasn't that sort of training on the ground. So that's why I started Certified Minds. So we now go into lots of pediatric medical teams across the UK, and we train them essentially how to look after these high-risk children. So it could be eating disorder children, it could be general mental health children, neurodiverse children. We run lots of simulations, and now starting to train lots of schools, because teachers have now become almost frontline mental health workers and are having really, really difficult conversations with kids and not knowing, how do I respond to a young person when they come in and I'm the maths teacher and they tell me they've hurt themselves the night before. And we know those real sort of key moments of disclosure are like make or break really for a young person to ever disclose again. So that's sort of how it started, very much around young people. And I think once I started going into the industries and going, oh gosh, you don't have any training either. Oh my goodness, you don't have any training either. There was schools and then workplaces and then hospitality. And these difficulties are everywhere. They, from the bottom up. And it's so important that we are training leaders. We're teaching emotional intelligence, self-awareness right from the beginning so that we can start getting some of the foundations, like you said, of resilience, well-being. I think just to clarify as well, well-being has become such a trigger word now, I think. And I'm not talking about yoga and fruit bowls, essentially, So yeah, I guess that's where we went with Certified Minds. Along the way, we know there's loads of waiting lists for services. Services are absolutely on their knees. We can't get the staff either. Funding is so low. And a lot of people need support and are willing to sort of go into private sectors. What we know is in private sectors, quite often all you have is access to a therapist. And you may be paying, upwards of £80 an hour for that type of support. Whereas there are people like me, I have a lot of private clients. I work with a lot of under 18s with anorexia, and we don't have somewhere for people to find us online. Mental health nurses, occupational therapists, social workers, sort of other clinicians that are currently locked out of private practice that are a lot cheaper. So what we're trying to do is put safer faces together so that users or people that do need support can access mental health professionals, but at a lower cost, and actually maybe something that's more specific to them. Not everyone's ready for therapy. Some people are, and therapy is great. I would say everyone should be in therapy, but some people need different types of support and cheaper options as well. So yeah, it was kind of like, let's train, let's keep kids in school, keep people in work, keep people out of hospital, and try and make it accessible for everyone. Now that's me cutting a very long story short.
No, it's really interesting. Also, you did mention, but you told me offline that you worked in hospitality for up to 8 years, yeah, yourself, and before you took your education. So you definitely have a steer on the industry, and it's one of the, yeah, I would say I've been away from the front line. Right now I'm in a journey where I'm also at the front line again. And I can see that high stress, high momentum, task focused environment. There's not much time to think and reflect. Yeah. It's there. Service is happening. The guests are there. The delivery is there. There's issue with water pipes that exploded, whatever it is. And it impacts the team, the quality of your organization, and how you make work. Yeah. And it's quite simple things sometimes are really a POS system that doesn't work when the customers put orders in, some kind of ordering system that's not working, or they got the order wrong because of the system that didn't work behind. And that elevate a lot of stress to these. And especially, we talked a bit before we started this interview, you have the workforce that's now coming in, and you said it really well, the workforce that was actually hit by the pandemic and lockdowns and was stuck at home for years are now joining the workforce, and they don't have the same skills as many generations before them, not because they are worse off in some kind of way, but they just live through a screen, and therefore their social skills is not the same. And I think that's really something that has, in a way, made me think, how do actually you manage these people, and what you need to help them with is it's totally different than what you needed to learn previous generation, which was much more technical.
Yeah, 100%. I think as well, look, hospitality as an industry almost combines all of those risk factors that we see for poor mental health, right? High emotional demands and unpredictability, low control, staff shortages, drinking, long hours, poor sleep, little time to recover. All of this stuff is stuff that we would talk about as affecting your mental health, affecting your resilience, not being able to maintain certain relationships, going to certain events. So essentially it's not, we are seeing a backlash from COVID for sure. And we're seeing young people, maybe they were having to deal with one or two things at a time. I mean, working in hospitality, you're dealing with 5 things at a time. You're like, I need to do this, I need to do this, I need to do that. That table's asked me for mayonnaise, that table's asked me for this. And you're like, gosh, I got this order wrong. So you spin in plates. And I think the pandemic to some extent hindered our ability to spin multiple plates at one time. And so not necessarily, the people aren't necessarily the problem, but the environment is a huge difficulty. And I think what we've now done as well is almost normalized frontline abuse.
Okay.
And we're seeing 80% of hospitality retail staff reporting verbal abuse, up to 30% or over a third of women experiencing sexual harassment from drunk customers. You're asking people to essentially absorb people's energy and frustration all day with a smile, and they might not be okay themselves. There's a lot of masking, I think, that's involved for sure.
And why do you think that has exploded, that kind of behavior in society? Because that's a society thing more than anything else. Because it's quite huge numbers, yeah? We're talking here, yeah?
Yeah. Well, I think it's easy to say sort of, cost of living, people having to work variable hours, overtime. There's a lot of stress, I think, that's going on, and people are spilling out into all sorts of places. And, it's not just the hospitality workplaces that might be unsafe, it's all the other workplaces as well. But then what do people do? It's still such a normalized coping mechanism, isn't it, to go and have a drink after we finish work. It's still really normalized. We even say it to people when they're hungover. We're still like, laughing at people that are puking the next day. And it's like, yeah, you've poisoned yourself. It's not that funny, but we do. That's part of our culture. So I think, unfortunately, that the hospitality sector is the coping mechanism for so many people, where they've built up their levels of frustration. They come to hospitality to let it out, but you throw alcohol into that mixture and it becomes normalized to hit on the bar girl behind who might be 20 years younger than you and doesn't feel comfortable with you saying that, or having arguments with people.
What do you do as the manager, the employer, when you hear that? You're thinking that could actually, if I haven't done anything active towards this is probably a reality in my business, especially if you have, drinking culture or evening opening or restaurant openings at night, but it could also happen during the day. I've seen really insane behavior both in retail and in coffee shops during the day, because people have become extremely impatient, yeah? Like, or something went wrong with their order, probably because there's lots of pressures that is really out of anyone's control. It's not something that can be fixed easily or something that's going to go easy. But what would be advice to managers listening to this and thinking, what the hell, where am I and how do I figure out where I am and what do I do about it? Yeah.
Yeah. I mean, it's a really, really difficult thing. I think in terms of managers, it's fixing the managers first. People rarely leave companies because of a company, right? They leave because of the managers. They leave because they have rubbish managers in place. You have to recruit people who are good with people, not just good with the coffee or not just good with the bar. You can have all the bar experience in the world. We have it all the time in working with young people and in inpatient. You could have all the degrees under the sun, but that doesn't mean, you've got the ability to look a teenager in the eye and say no, and hold that boundary. So I think it's really about training every line manager to recognize escalation. We're so good at being reactive as opposed to being proactive. And I think having people on shift that can, recognize distress or escalation, having supportive conversations, it's how do you embed a culture into your workplace? How do you create that vision that has got some really key values underneath it, and then start to embed your staff in that, and then start to build on top of that. I think something like hospitality, because the job may be perceived as everyone can do it, which I don't agree with, by the way. I think people in hospitality work incredibly hard. You just take what's given to you as quickly as you can. And not only does that set you up to fail, but it sets people up to fail. We think we very rarely look around and go, hang on a minute, what is it about our workplace which seems to be making healthy people unwell? And it's such a good question just to start with. Is it psychological safety? Is it poor leadership? Is it staffing? Is it communication? Is it our recovery time that we're giving to our staff? And where do our staff go, when they do feel not well or they're not coping? Because burnout is huge, absence is huge, and there's a huge knock-on effect for those that aren't.
Just repeat that question, Ruth, because I think it's important that the audience grab that question, because that's a really powerful one.
It's not just about hospitality, it's like once a month sitting back and looking, what is it about our workplace that makes healthy people become unwell? And it's remembering that I hear people say, oh, they've got mental health. No, we all have mental health. That's a thing. And I think what we've done is we've almost diluted the mental health system, because we're talking about mental health issues or mental health problems as if they are mental health disorders. And they're two very, very different things. We all have mental health issues in any given year, in any given month, in any given week, right? We all have that. Sometimes we sleep better. Sometimes we eat better. Sometimes you got doing presentation and you feel like you're going to puke. You've got food poisoning, you're nervous, super normal. And I think what we've done is we've overlapped that with things like actual anxiety disorders, depression, emotional dysregulation, mainly because of social media. I think, in social media, it's great we're talking about mental health, raising awareness, but there's so many videos of, the day in the life of somebody who's got this really mild thing, and actually it's stigmatizing for the person who's got the bad version, the severe version. And so I think we overlook it so much and just assume that you've got that and you've got that over there, while not recognizing we've all got mental health issues. You don't have to be on medication, or you don't have to be seeing a doctor or a psychiatrist to be able to look around your workplace and go, do you know what? That area is going to cause anxiety, and that area is causing burnout, and that area is causing conflict, which leads to mental health issues, which we're all susceptible for. So there's not going to be anyone on your team that isn't susceptible to having mental health issues.
Yeah, and it's quite interesting, that thing, especially in the industry where I see often we burn out managers, and the burnout manager probably also going to burn out his staff or her staff, because that's the energy they send on, And again, how do you actually help them to get to a point where they have enough resource to do the job they need to do well, so they can put the right things in place for the staff, and therefore work doesn't become another pressure point, because I think there's multiple pressure points, I guess, as well. When you have issues or challenges, it often doesn't have to be work that's the issue. It could actually be other things outside work, but actually then you need work to be a safe and function place where I go and have high psychological safety, or feel that actually I know when I'm there, I'm safe, and things works, make work, I always say, And I think often and it's quite interesting in the industry, since the pandemic, we've been under huge change as well, because we've been under pressure to finding commercial models of work, changing of the way we serve customers, more technology, so on. There's lots of change as well that's been put in on pressure on the organization, And so that also creates feeling unsafe, So how do you actually manage that? And I think there's nothing new in this, but actually you have to be aware there's generation coming that is maybe need even more support to coming to work. And I think it would be interesting to talk a bit about them, because what we're going to do with this new generation that comes out, because you said they're misunderstood,
Sure.
And how we're gonna onboard them to be successful, because they will join our industry, but how do we actually get the best out of them?
Yeah. Do you know what? I think we really have to start embedding some of this stuff in almost like mandatory induction programs. It takes a lot of emotional intelligence, or at least a lot of coaching, motivational interviewing to know what you don't know. And I think, unfortunately, we've got a lot of people at the moment who don't know what they don't know. And they see, it feels like there's no value in the journey. We see so many influencers online that have all of a sudden got success, or all of a sudden bought the thing and now they're super happy. And actually, we don't see that process behind it. So everyone feels like I can just have the thing. And they forget that there's loads of work to do. And actually, the process is nice. The journey is nice. It's the only way we get dopamine is if we put a bit of effort in and it all pays off at the end. And I think we live in such an immediate, gratifying society, and people go, yeah, I can do that, or I'll just do that, or I don't have to do that if I don't want to. And there's almost like this level of entitlement from some people to just say, I should be able to do bare minimum and still get paid for it, because we see so many people that appear to be doing that online, essentially.
And it's super interesting, fix my problem in a day. Yeah. That's, or I will, all my big areas of life, financial, emotional, relationship based, family, all will be solved if I join this program. And you'll probably go on a journey by joining that program. I'm not saying it's work, but I'm been in the past also very much like, okay, this will give me this, and then I can elevate to that. And actually what you find out is actually it's knowledge, but it's not before you apply the knowledge and really put lots of work in. And if you can't, I think we talked a bit about before we start out, when you start your own business, you have to start enjoying the process, the ups and downs of it, and actually be even more aware how you regulate yourself and get yourself ready for the next day. Yeah. Because some days are very low and some is very high. Yeah.
Sure. And that's resilience. We've redefined resilience as coping in that moment. And it's not, resilience is about, how do I put things in place now for when they go really wrong? How am I going to deal with it then? So I've already built up a load of coping mechanisms so that when things go wrong, or things start to get difficult, or something unexpected happens in my life, I've got resources. And I think we are really quick to label coping in the moment as being the strength or the strong thing. We're masking. We're not coping, we're masking. At some point, you're going to have a breakdown. We've got to start thinking about putting in resilience at a much younger age, much sooner. And I think for managers that are recruiting, great, we need to learn how to pull pints. Okay, great, we need to learn how to use the till. I think you gave the example earlier. But actually, we need to be teaching about, well, what do we do when you're on your second long split shift and this breaks down and you run out of that and someone's screaming at you over the bar? That's when you need to pull on your coping mechanisms. And none of that's easy stuff. All of this has to be embedded in induction programs. Part of learning is going, I'm rubbish at that bit. I'm really rubbish at that. And that's where the learning happens, not just do, but actually take a minute, sit back. Okay, what are your early warning signs? What are your early warning signs that you're really starting to struggle? Okay, 5-minute check-ins. Like if you're thinking just, an average shift, no one comes in and goes, right, this is how I'm going to distribute the workload this evening. You're kind of just all expected to muddle in. No one checks in with staff for 5 minutes before and 5 minutes after a service, for example. Only the smokers tend to get the breaks. So many people take up smoking when they work in hospitality because they're the only ones that get the breaks.
Interesting.
It's wild.
When you see it could be a restaurant, or it could be a ward or a team you work with where they start putting these systems into place, what typical happen on that journey? They, of course, come to realization we need to do something. But what do you go in and do then? What in top line? What are they trained in? And what kind of results do you see over a period, I guess, when these things starts to become, it's happening every day. We are preparing for the event, the situation that's coming around the corner at some point.
Yeah, absolutely. Like I said, I suppose there's a bit of a difference between training managers to then training staff. I think when you're supporting managers, team leaders, stuff like that, it's like, how do you recognize the stress in yourself and the stress in others? How do you handle emotional or challenging customer or staff, let's be real, interactions? How do you support your colleagues after incidents like that? How are we going to support your well-being without losing productivity? How do we build resilience and psychological safety, even sort of de-escalation skills? Because if you start fighting fire with fire when you're on shift, it doesn't work. How do we teach managers to do the sort of regular check-ins with their staff and making sure that things are aligning? We know that burnout is now considered part of the job, right? It's like almost half of hospitality workers. There was a study to suggest it's around 62% of junior staff are burnt out in working hospitality. Burnout creeps up on you so quickly. I mean, I burnt out after working in the hospital throughout COVID, and it absolutely floors you. And recovery from that, again, it's something we spoke about just now, can take a really, really long time. And so, yeah, I understand that people will say, we can't afford training and we can't do this and we can't do that. But it was something like £51 billion was lost annually last year through poor workplace mental health. That's wild. Deloitte did a study which found it was like an average of £4.70 return on every pound invested. So rather than it being like, what does it cost? It's like, well, no, what does your inaction cost? Absence rates climb when workload, burnout, unaddressed mental health issues finally catch up, and then workers are taking time off because it's the only recovery option, which creates more gaps for the other teams to fill, and then they're off. 3/4 of hospitality staff have faced mental health struggles at some point in their adult life. 1 in 3 experience it last year alone, but there isn't anywhere for them to go, or they don't go and speak to HR, about these difficulties, because everyone's worried about what that might mean for their job. We're working in an industry that we need, and in a time where we've got such high costs of living that you think, my gosh, how are people going to perceive me? Oh, my reputation, is this going to affect my career? Are managers going to see me differently? I'm not coping. There's still so much stigma around it, which just seems bizarre to me because we're talking about it so much, online at the moment.
What is like, well, I think it's really interesting. The burnout is really horrifying, and also the numbers around, how many, billions of pounds those lost through mental health issues in the workplace last year. And burnout is a really obvious one in hospitality, especially with managers. And manager is really the one that runs the show, set the team, and when they burn down, it has a huge escalation on the wider team. So the cost just explodes in a way. It's a hidden cost. We don't talk about it. But what would you say if I was let's say I'm an owner, I'm a director of managers, what should I be looking out for as burnout starts to creep out in these people? When is it that I can do something before? There's, of course, again, prevention is better. But when I see, what are the early signs in your experience that people are on a route to hit burnout and we need to pull them back, or else it's going to have they're going to have a totally, where they're not going to come to work, where it's not going to work for them, where the recovery time is going to be very long, and therefore very costly for everyone,
Yeah, 100%. I mean, to start with, you are going to start to see certain problems, people calling in sick, guests, customers being unhappy, being behind on service, not hitting targets. I mean, that stuff, is quite clear to see. But burnout tends to be about the fact our brain is now staying in this threat monitoring mode, right, for weeks or for months without an opportunity for it essentially to return to its baseline. And that's where we start to see the emotional exhaustion. or the reduced empathy, or the fight and fire with fire, the irritability, or punishing another member of staff for something that really wasn't that big a deal, poor decision making. That's when you start to see, oh, okay, hang on a minute, we've got quite a few people leaving, we've got quite a lot of errors in judgment, the orders aren't right, no one's being coached, no one's being trained. And unfortunately, we start to create these cultures that start to cascade down and down and down. And any new staff coming in that are watching managers behave like that are going to do that, right? You're just stuck now in a cycle of burnt out managers, stress teams. The stress teams leave, the manager gets even more pressure because they've got no staff. They hire rubbish staff to fill the gaps, and you just go and go and go round in a cycle. And it's, how do we design workplaces where managers aren't operating in crisis mode all the time? So many services, including healthcare, we're fighting fire all the time rather than sort of getting anywhere.
Yourself are running businesses and been in both in hospitality and healthcare, like you said yourself, just like how do you, I would say, prepare? And you're very honest, you shared as well, you hit by burnout after the lockdown and pandemic. What do you do? Like, because I guess what I've learned, and I might be wrong on this, we all get different tools, and I have different coping mechanism as well over time. And I think if I hadn't by luck had good people around me during my career, managers and my parents and my friends that actually helped me reflect when it went wrong, then I think I wouldn't do anything different next time I hit the same problem. In my early days, I've always tried to work myself out of my problems, which you can do to a certain degree, but then that's something you say, then you get hit at some point, then you hit the wall, and then you have to climb again, and then you go. And it's really spot on when you said, like, decision, you think you're still making really good decision, but the way you communicate, the way you behave, it's very clearly you're burned out. How do you do that? Because I guess you have the same challenges as everybody else. As you said, we all have struggles, but how do you manage that thing about running multiple businesses, and really you're giving a lot and people are taking a lot from you because you're working with such an emotional and energy demanding job? Besides, it's probably very given, but you have to give a lot as well.
I'm absolutely no saint. Anyone that knows me will know I'm no saint in that type of thing. And do you know what? There are a few things I choose now not to compromise on. I haven't had social media for over 5 years, like anything personal. I use LinkedIn now, which I regrettably got a while ago and just bit the bullet and was like, oh, okay, I'll do it. But I haven't had, Instagram or anything like that for a really long period of time. And I cannot tell you how many hours I got back in my day, how much I'm not thinking about what other people are doing. And actually it increased my socializing, because I don't know about your holiday unless you call me and tell me about it. And now I'm not assuming how good your holiday was because of the select photos you've put online. We're now sharing oxytocin, we're now having a conversation about it. And I think connection and relationship is so important. So I really honestly would advise to absolutely anybody. I had a year on the ward where the young people just had sort of smartphones. And, it's so unfair. You get social media and we don't. And I just remember going, fine, I'll get rid of it then. And plan to do it, for like a month. And, that's 5 years ago. And I cannot tell you how much better my brain is. Sleep, I do not compromise on less than 8 hours a night sleep. If I'm asleep after 10:30, I'm fuming, quite frankly. I think both of those things are really important. I've started reading a lot more. It's not easy to get. It's like having to try and find a way of going, actually, exercising or reading is just as important as sending that other email. Running businesses and doing private work, seeing patients, it's a lot, and there's always something to do. Always. And I'm envious of some jobs where you kind of go in, you do your shift and you leave and you're like, but actually, you have to become really strict. And I'm learning. I'm massively learning, and I'm really open about that to people around me, that I'm not the best at resting, and so that people hold me accountable for some of those things.
Yeah, because you have to talk about it with other people. So they say, "Oh, how is it going with that?" And I don't have a stop button myself, so and I think many hospitality people that choose this industry is also for the dopamine of it. You can
Oh
see
yeah,
when you can see, and when you work with people as you do, and you're coaching and you're helping people, giving you tools, you get the dopamine when they do the shift, and you work hard, so hard, and you give so much. So actually, I have the same as you, and I think it's really important for many managers to have people that keep them accountable on their good habits. It's funny, the thing with social media, I have it as a necessary evil as well, because running a podcast,
sure.
be wants to see some change happening in the world, you need to put yourself out there. But I'm very much trying not I to consume it, and actually, but then it's funny, the other day there's somebody that sent me something, and I have an Instagram account then, and I caught myself because I was tired. It's been a tough week, and that Friday suddenly I looked and I thought, I fucking spent 25 minutes now being consumed about nothing. Yeah, that doesn't really actually bother me anyway. Some of it was very interesting, but what do I care about something that happens in the United States out of my control? I'm not going to do anything. And then you get emotional wind up by it. And it's like, and you can see how addictive that. And then it took me a couple of days, and I did again next day, not 25 minutes, but 10 minutes, you say. And it's just to stay away from that. Yeah, I think that's like really what I learned. And I also think it's okay to be busy, because you said, "Oh, I'm busy, I can't relax." But there's also something about when you have a calling and you're working on something that matters, you should tire yourself out doing that in your life, because that's meaningful in a way. But of course, but don't break relationships for it. Yeah.
Yeah. And I think I read a fantastic book called The Dose Effect. And, I think we forget the after effect of using something like social media. There's something like, got these short videos that you see will release what should take us 4 hours worth of dopamine to earn. And so we're opening our phones first thing in the morning, which just completely ruins our day. We release all this dopamine from all these videos, and our bodies essentially go, crap, too much, and dips us below our baseline. And then, of course, we're unmotivated. We don't have a drive. We're finding it hard to start tasks. We're not getting pleasure from things. Our mood's low. We've got brain fog. We've got no energy. And then everyone goes, oh, I'm sick. I'm like, oh, I have to call in sick to work, or I've got ADHD because I can't focus properly in this moment. And so what do? I go back to my phone again, or I go for sugary drinks, or I go for substances, because I'm trying to get my dopamine levels back out. And I would say, like, first thing in the morning, people roll over and pick up their phone and they're straight online, and it is just, you mess your whole day up. Cognitively, neurochemistry is different after you've done that in the mornings. So important.
What is the one thing you never compromise on in you had some habits there, but like I guess it's the phone, yeah? That's the
Social media, yeah, 100%. Do not compromise on social media. Do you know what? Sleep as well. Like, I would rather call it a night and get my sleep. I panic if I don't get my sleep. I think as well, like, you have to learn, working in something like, mental health nursing, you almost have to protect, like, your clinical brain, I would say, like, and put boundaries around your empathy, because we carry so many people's stories, right? We carry so many emotions. And I think a hard lesson I've had to learn is that being compassionate doesn't mean carrying everybody's emotional load home every day. And worrying about this and worrying about that. I think protecting my empathy has had to become really, really important to me.
Yeah, you just made me think about something. I can't find the book here, but is that one there? No, it's not.
I'm just scoping out your books behind you.
There's one that's called Compassion in Action, and it's about leadership. And Lars I had on the podcast early in the year, we talked about, the importance of caring for your people and be compassionate. But doesn't mean that you need to, as you said, you need to set some boundaries, because your job is there, of course, to care for them and doing your best. But there's a limit to what you need to. It's actually setting boundaries for everyone. And actually, if you have 3 children, you have to love them equally. So it does not because you like one employee more, then you might like one employee more, but you can't. Your job is to be compassionate and actually make sure that you distribute enough help to all of them. Yeah. And I've done everything in your power to help that person. It might not work out, but you did everything that was in my power. You have to be able to ask that question afterwards. And that goes with mental health as well. Like, you can only do as much for them, but you can't do everything for them. Yeah.
No, you can't. And I think that's something also we think about with managers. There's a difference between burnout and compassion fatigue, and when you are exposed to people's difficulties or problems or stress all of the time, I think it's wild, in healthcare. You almost can't have an absence day with compassion fatigue and say, look, I don't care about anyone apart from myself today. I can't come to work. And it's, thinking, am I tired of this work, or am I tired of carrying everybody else's pain all the time? And that doesn't make you
or tasks. Yeah.
Yeah.
Because I see that often very good managers take on other managers' jobs and take the responsibility for them. And then when they start to get burned out, they start, as you said before, snapping, throwing other people under the bus as really the signs. And then that you have to go in and get something done, either help the team, put resource to the team, or find out who is actually not fitting into the team and actually damaging the mental health of the wider team. And it's really, really important. It's very hard, actually, these things. And there's lots of difficult conversation. And I guess mental health, like, one thing I wanted to stop by as well, how do we actually talk about that? If I'm now running a hospitality business and I've never done any of this probably, how do I actually start to get this started, and what do I fix first? And I guess it's the conversation in somehow kind of way.
Yeah, I think as something actually that we get a lot of requests for training is about how to have difficult conversations. I can't tell you how often we have that, from, working with distressed children to HR managers to, hospitality, things like that, high performance. It really is language. Everything is essentially about language. The difference between saying, you need to sort your timekeeping out, you're late again, compared to, I've noticed that you've been arriving late a few times recently. What's going on? Same message, 2 very different conversations. How often we go to people, you seem stressed, rather than, I've noticed you're a little bit quieter over the last couple of weeks. How are things going for you? There's so many. We should teach in every single industry how to talk to people. It is so important. And also how to make people feel heard, because we see it all the time with teenagers, the classic teenage comment of, no one understands me, no one's listening to me. We are, but that person doesn't feel heard. And just feeling heard is so unbelievably key. It's like returning to work conversations even, are you fit to come back yet, compared to, what's going to help you feel more confident coming back to work. Open-ended questions, affirmations for people, not just telling people you should do this and you should do that. People often know what their job is. People often know what they're meant to be doing, but people we're humans. We like to follow our own plans, don't we? So it's like, hospitality managers aren't therapists. I'm not asking you to be a therapist, but they do need to be better listeners. Things like motivational interviewing, gives real practical framework essentially to conversations that, build trust, reduce defensiveness, and help employees find their own motivation, improve their own performance, improve their own well-being. So I think to start with, you need to have managers that are relationally good, who are self-aware, that have got emotional intelligence, and then train them up to be coaches, train them up to, have these sort of compassionate conversations with staff. because you can help your staff to be better and to perform better if you switch your language.
Yeah, and it's so interesting, the listening bit. We are so bad at it as humans, but as an industry as well, because we are so focused on the tasks and we forget the relationship, the why, the how, the when, and the what. You
Mhm.
actually presume because somebody else is doing it a slightly different way, they're not performing the task you asked them to do. They might do it, and they might didn't understand it was important for you to get it done now. So you
Yeah.
might not have been clear when you gave the instruction as well, and that's very interesting. And then how have to have difficult conversation, as you said. It's such a key thing to learn in life, and I think you
Mhm.
can never practice too much on this.
Yeah.
Uh, I didn't find it easy in the past, and I still don't, but I practice in it because when you run business and you get responsibilities, you get kids, you need a lot of difficult conversation, yeah?
Yeah,
And
in a relationship, you need difficult
yeah,
conversations.
yeah,
It's just the basic. Do you know what? Let's get it on the school curriculum. That'd be a good one, wouldn't it?
yeah,
Write
yeah.
down the basics.
Yeah, I think that's very good. That was really good. Like, so yeah, so start with actually getting into the art of conversation, and especially if you want to introduce something that could actually help the mental health in your workplace, like contact you or wherever you go to actually learn your team how to have difficult conversations. Yeah. What is the one question you wished I've asked you, Ruth? I didn't ask you, and what would you have answered, and what is the question?
I would have liked you to ask me about whether or not we are talking honestly enough about sort of substance use
Mm.
in the
Mm.
workplace. To be honest, I
Yeah.
think it's something I talk about a lot at the moment. I think we've reached a point where drugs like cocaine have become far more normalized than many people are comfortable to admit. It's really rife at the moment in social settings. I think, a few decades ago, it was a real like rich man's drug, and it just isn't now. And it has just become part of this nighttime economy. It's not shocking anymore for someone to have cocaine on them or to be using it during a night out or to be using it on shift. It's become incredibly normal for not just, the people in the pubs to be using it, but also the people that are working. And that shift in society should really, really concern us. I went away to Vietnam for a few years, about 2016-ish. And just wasn't something that people were talking about. It's not something I saw. And when I came home, I even saw people that I'd been at school with it's almost wiped out a generation of people. And, as a psych nurse, we see not just the effect that it has on mental health, but like relationships and sleep and anxiety, physical health. I think people feel now like if I can afford it and I'm not stealing to buy drugs, it's okay. But we forget about like compounding effect, right? And it does start as like, oh, it's just helping me get through the weekend, or it's just keeping my energy up at work. But the problem that is now built up in the UK, particularly, I would say it's an epidemic, at the moment. And I think for employers, particularly in hospitality, but also in other high performance industries, sales teams, for example, it's not about being the police, but it's like, let's start thinking about the fact that people are relying on substances to cope with stress, that it has become normalized, that, exhaustion and pressure is having a huge, huge impact on whether or not people are going out and taking drugs, and what the effect that has on them for the whole rest of the week before they start again the next weekend. I think we're not talking about how rife it is at the moment in pubs and clubs, personally. And I'm talking about weeknights. This isn't just a problem that's like a Saturday night going out. There's a huge issue going on.
Yeah. And I think, I guess, as you said, it's like substance that's taken to cope in life as well. So therefore, it's a reality in your day-to-day work as well, because if you are, it's not because you're just partying wild. It could also just be to cope with life. Yeah. Life is taking over and I need something to cope with it. Yeah. It's not alcohol, but it's cocaine instead. Yeah.
Sure, and I think the two of them sort of come hand in hand, at the moment. And I think, I've heard of people that have had to stop drinking because they can't drink without doing it. And I don't think people start taking it by going, I'm trying to cope, but it's a state changer. It does offer some form of escapism from whatever is going on, and people do it because it's fun or because everybody else is doing it. But the more normalized it becomes and the more bar staff and customers are doing it at the same time, the more we're just perpetuating the issue. And I would love to see more people talking about the cocaine epidemic that we're seeing.
Yeah, love it. Great question. Ruth, where can people find out more about the work you're doing, connect with you online, even though you don't live online, you say, but you're on LinkedIn, you already said that.
I am on LinkedIn. So Ruth Jacobs on LinkedIn. You can also search for Certified Minds. So we have a website, www.certifiedminds.co.uk, and keeping an eye out for Safer Faces. So we will have an app in a few weeks' time where people and practitioners can come and try and find, way more cost-effective mental health support, which is so exciting, trying to help get some of those waiting lists down, or essentially trying to intervene before crisis happens because of how high, thresholds are and all sorts of things like that. But yeah, we offer all sorts of training for all different industries. And I think I would just be really quick to say, invest in your teams, because it's going to cost you a hell of a lot more in the long run.
Great, Ruth. I will make sure we put the links to the website you mentioned in there as well, so people can share that with their network, so we can have the multiplier effect for all the people tuning into this. Thank you so much for coming on and talking about this difficult subject, which actually we need to always have in our minds. It's here, but actually, how do we actually manage the new generation getting into the workplace, and how do we actually start to talk a bit more about having difficult conversations in the workplace? Exactly. I think it's quite important to have difficult conversation because they actually take stress away. Then you take the air out of the balloon, as I say. It's on the table, and then we can deal with it from there.
Absolutely.
And then, of course, then again, cocaine. Yeah, like we need to bring that up, especially in our industry that has been very well known for having lots of issues with that. I'm sure it's much bigger than we think. And it's not on my radar every day, but now I'm just thinking, oh yeah, that's actually a huge thing to think about in the workplace. And is it to cope with work, or is it just to cope with life? It doesn't really matter. It's there, and you need to be aware of it as a manager and lead in the business. Sending you all the power and energy and love on this journey. It's really important work you do, and please take care of yourself, because we need your energy to help make this better.
Oh, thank you, Michael. Appreciate it a lot. Thanks for having me.